Happy International Men's Day 2025. Today's episode of Begin, Build, Blossom Your Business Journey is a special initiative presented by CME Accounting LLC in partnership with the Saint Lucia High Commission based in the United Kingdom. Today's episode focuses on men's health and well-being. Please enjoy the conversation.
As we open today's episode, we want to give you a little heads up. This conversation takes a deeper look at men's wellness because good health is the foundation for strong leadership and sustainable growth in business. We'll be discussing topics related to men's health, including mentions of body parts and other terms that may not be suitable for younger listeners. If you're listening around kids or in a public space, you may want to use headphones. This conversation is meant to inform and empower, but it is not medical advice. So please check with a healthcare professional for anything specific to you.
If you have a man and a woman and they break up their relationship, the man should not cry but why not? If he loves his ex-partner, he wants to leave her.
He felt
there's nothing wrong with crying.
No.
It's just
don't stay crying. Strong men ask questions, seek help, and take care of themselves.
Welcome to Begin, Build, Blossom Your Business Journey, the podcast where we share valuable insights, resources, and motivation to fuel your entrepreneurial spirit. Let's build a supportive community together. Don't forget to subscribe or follow wherever you listen to podcasts and be part of this journey.
Welcome to a special edition of Begin, Build, Blossom Your Business Journey. I'm your host, Angela Sendenis, and today we're shining a spotlight on an issue that touches families, communities, and workplaces everywhere: men's health. This episode is produced in collaboration with the Saint Lucia High Commission in the United Kingdom in celebration of International Men's Day 2025, a time to honor men's contributions, challenges, and encourage an open conversation about well-being. Our guest today is someone whose life and career beautifully reflects what it means to begin with passion, build with purpose, and blossom through service. Our guest is Dr. Joachim Jimie, a son of Saint Lucia soil. Dr. Jimie is a urologist whose work goes far beyond the clinic to inspire healthier, happier lives for men. Born and raised in Saint Lucia, Dr. Jimie moved to Cuba in 2005 to pursue his medical degree. After completing his studies, he returned to Saint Lucia to serve his community, completing his internship and later working as a senior house officer in the surgical department at Victoria Hospital, where he focused primarily on urology, the field that captured his professional interests. His commitment to excellence later took him to the United Kingdom, where he pursued higher surgical training in urology. Along the way, he developed a subspecialty interest in andrology, male infertility, and genito-urethral reconstructive surgery, leading to a prestigious fellowship at Guy's and St. Thomas Hospital in London. What's especially inspiring is that despite his success abroad, Dr. Jimie remains deeply committed to his roots. Motivated by a desire to give back, he returned to Saint Lucia to help strengthen urological services and improve patient care across the island. In today's conversation, we'll explore his remarkable journey from Saint Lucia to Cuba to the UK, the lessons learned along the way, and his mission to debunk myths, break the silence, and redefine men's health. So whether you're tuning in from Castries, London, New York, across the Caribbean diaspora, or anywhere in the world, this episode is for every man, every family, and every community championing well-being and legacy. Welcome, Dr. Jimie, to this special episode of Begin, Build, Blossom.
Thank you very much, and thanks for having me.
Okay, wonderful. Well, we look forward to learning from you about men's health and specifically about urology, so we can debunk any myths, we can bring clarity to understanding what the field is. But before we get into the business of talking about that and, you sharing your story, we have this section called Rapid Fire, where we'll get to know you a little bit better. So the first question under that is, what's one word you would use to describe yourself as a child and one word you'd use to describe yourself as an adult?
I think as a child, I would probably be describe myself as being inquisitive. I remember every time my mom used to go to parent-teacher conferencing, the teachers used to be like, he talks so much or asks so many questions. And not in a bad light, but it was always in the hope of learning and getting more information. So always inquisitive about asking about things. So that's how I would describe myself as a child. And I think as an adult, I would say that I'm quite ambitious. I think there's always something to be done, and I'm always willing to push to get things done. I'm going.
Okay, so that's why we'll learn a little bit more about andrology later on, right?
Most definitely.
Okay, so the next question has to do with, is there a book or movie that you love very much that you wouldn't mind sharing with us or recommending to our audience?
Yes, definitely. And I think I'll probably give an atypical answer to that and say, for me, out of all books, I would say the Bible. That is hands down my favorite book. It is a book where you find a bit of everything. You find encouragement, you find love stories, you find, how to move forward. You get a bit of everything compared to if you just read one separate book where it might just be a love story or it might be some educational stuff. But the Bible, you have it all in there. And I think this has been one of the most inspiring books for me, which is why I think I am where I am today. So it would definitely be the Bible as my recommended book.
Okay, excellent. Thanks very much for sharing that. So I'm sure our audience will be inspired, and those who have not read the Bible yet will certainly go out and do so.
Absolutely.
Great. Now, our next question is a fun fact. What is something you'd like to share that no one knows about Joachim? Something fun.
Yeah. That is an interesting topic. And I'm questioning if I should say, and I think I would say so. Persons who know me closely, this would probably not be a surprise to them. But for people who just see me around and who don't have that sort of connection with me, I would say that I'm heavily invested in politics.
Okay.
Yeah. I don't think my dream or my aspiration is to become a politician. But politics as a science on its own is something that I love. And especially now that we're heading into that election season in Saint Lucia, it gives me that thrill because think, it does. Because I think with politics, that's where you understand policies, that's where you understand, decision making. And that's very important because that's how whether you decide whether a country moves forward or whether a country regresses. So that aspect of politics is what really intrigues
Captures
me.
You.
Absolutely. Being able to compare what different governments, the different policies that they have, and, to that sort of stuff. So people who don't know me very well might not know that about me, but my very close friends and my family members, they would just shake their head when I start talking about politics with them.
Okay, all right, great. Thanks for sharing that. That's very interesting, I would say. That's what I could say. I would not have guessed. So thanks for that. In terms of the next question, it has to do with a country. If there was a place that you could visit tomorrow or right now, where would that be? Anywhere in the world?
Again, a bit of an atypical response here. And I would say Jamaica. Yeah, there you go. And the reason for that is probably going to surprise you. I've been to Jamaica at maybe 4 or 5 times. So it's not a case of I have not been to Jamaica. But with recent events in Jamaica, this has again, struck my my interest in going back to Jamaica. And the reason for that is, apart from the fact that I'm a urologist by profession, disaster medicine had always been something that I've been excited about. So I remember the time of Ebola. I actually was willing to volunteer to go to Africa to help with Ebola. I remember my mom saying to me, "That's not happening."
I could imagine.
And even in Saint Lucia, when we were preparing a task force in case we had Ebola cases on the island, I was one of the leading physicians because these kind of stuff, I just love that kind of stuff. I'm helping
that
the humanitarian aspect of it. There was a a particular time I was interested in actually joining Doctors Without Borders.
Okay.
So in the with the recent events in Jamaica with the storm and the devastation that they've experienced, if I had the opportunity to go there to help, I would absolutely love that.
Okay, well, people who are listening, you have a doctor who's offering his services, so reach out. All right, well, thanks for sharing that. Now, the final question on the rapid fire is about a childhood memory that brings a smile to your face. What would you like to share?
I would say singing in church as a little boy. I still do a bit of singing. I'm not professional, but I still do a bit of singing. But when I sit back and I remember when I was a little bit, because despite the fact that I'm a bit tall now, I was really short when I was small. Up to my teenage years, maybe up to Form 4, I was always the shortest person in my class.
Okay.
So I used to be that little short boy on the pulpit singing. And even now with my friends, or some of the older folks in the church, when they see me, they'll just keep reminding me of, because I used to sing the same songs over and over and over and over again.
Because that's what you knew.
That's what I did. And so then even when I go home every now when they see me, they'll just remind me of, remember when you used to sing that song, and they'll just mimic what I used to do. So, these little memories. So I would just smile every time I remember that.
Okay. Yeah, you see, you know what? Even as I ask you the question, the smile seemed to have already been coming. Thanks for sharing that with us. I hope our audience enjoy getting to know Dr. Jimie a bit. Now, we will start off with learning about the man, the human behind the doctor. So if you can share with me those early years, what were you like as a child when you started to realize that you wanted to get into medicine? What was that moment?
Yeah. I mean, I'll be honest, as a child, sometimes they ask, what do you want to be? And sometimes you just say random things because that's what you probably hear people saying, or that's what you see around you.
Correct.
And then the reality is I had no particular reason for wanting to become a doctor. I always wanted to become a doctor, but I don't think I actually had a reason for it. And it's just because that's what you heard around you. Because in our society, people think unless you're a doctor or you're a nurse or a particular profession, you're not really, you don't have that sort of status in society. And maybe that was a reason, but the reality is I had no definite reason as to why I wanted to become a doctor. But what I do know is every time I went to the hospital to visit someone, it just felt right. Like I used to always be, and like I said earlier, I was always inquisitive as a child. So you'll probably see me sneaking around, looking around to see what's going on and asking questions. So it felt right being in the environment every time I went there. But in terms of a reason in the initial stages as a child, a little boy, I had none. But eventually, as time goes by, you realize, okay, being a doctor, you get to help people, you get to bring out that humanitarian aspect. That obviously then became the main reason for becoming a doctor. But the truth is, I think the first time someone asked me and I said a doctor, I had no reason for it.
You just pull it out of the air.
I just pull out the doctor. Here I am as a doctor.
Okay. So in terms of studies now, so you've made that decision. All through secondary school, primary school and secondary school, was the doctor thing still there, or did you lose interest? Always.
No, never. What the only thing that fluctuated was what type of doctor I wanted to be. And it kept changing. Yeah, it kept changing. Initially, I wanted to become a gynecologist. Ask me why. For obvious reasons. As a little boy, you're like, oh, I want to become a gynecologist.
Why not?
And then you're like, okay, you get exposed to it and you're thinking, I love that. And you look at medical series and you're like, oh, I want to become a cardiothoracic surgeon. So it just changed as time went by, but it was always medicine, the field of medicine, always.
For sure. Okay. All right, great. So that means it's a passion that's just deep-rooted within you.
Absolutely.
So in terms of studies now, so we know we're going to be a doctor. You started your first stage of studying medicine in Cuba. Tell us about the decision to go to Cuba and the experience in Cuba.
Yeah, so obviously everyone would appreciate how expensive it is to get to study medicine. I would probably say, just speaking at the top of my head, I don't have any official figures, but I would probably say it's probably one of the most expensive career path that someone can take. So that was one of the most limiting factors. So when I finished my A-level program, I started applying for scholarships. Now, in our region, most persons would be aware that Cuba has been very good
Yeah,
in terms
generous.
of,
Yeah.
yeah, very generous. That's the word, yeah, in terms of assisting the rest of the, not just the region, but even the world. If you look at, there are persons from many different countries in Cuba
Mm-hmm.
who otherwise would not have had an opportunity to become a doctor,
Correct.
study medicine. They get that opportunity.
Mm-hmm.
And I remember I did my SATs. I did loads of stuff in preparation for whichever scholarship comes my way.
Yes.
That's what I'm
Yeah.
going to take, because I
Yes.
just
Yeah.
knew my parents were just not, they were not able to
Yes.
to
Yes.
get a loan, to guarantee a loan, or to pay off.
Mm-hmm.
It was not possible. So I had to depend on a scholarship. So I made all the necessary arrangements in terms of whichever one comes my way, that's the
You're
one I'm
going to.
grabbing.
Mm-hmm.
Yeah.
So preparation was waiting for success too, right?
Absolutely, absolutely.
Or opportunity,
Um,
as they would say. Yes.
yeah. And then I applied for the Cuban scholarship. I remember that year there were only two scholarships being offered. And
Mm.
I think when I asked, there were almost 100 applicants.
Wow.
So I thought to myself, there's no
Mm.
way.
The
There's no way. I
possibilities,
mean,
yeah.
yeah, I'm like,
It's like
that's
one in a
impossible.
hundred.
That's impossible. But I knew I had the grades because, there were certain requirements that you had to meet in order to be eligible for the scholarship. So I had the grades.
Mm-hmm.
You had to provide financial, proof that, that you were not really able to, and stuff like that. And then I was one of the applicants. I was one of the successful applicants. So that's how I
Well
made my way
done.
to Cuba.
Okay. All right. Great. And so how long did you spend in Cuba?
So Cuba was 7 years in total. So you do a first year of Spanish. So you do just to get familiar with the language. And then the second semester of that first year, you do a bit of like the sciences in Spanish. So biochemistry, not
Mm-hmm.
just Spanish, but the kind of medical Spanish kind of thing. And then you do your 5 years of medical school per se, and then an
Mm.
internship year. So that takes it up to 7 years in total.
Okay, so you also do an internship year in Cuba.
Before you're
No.
able to do your exam, actually. So if you fail
Okay.
your internship, yeah, you're not eligible to do your final exam.
Okay, wow.
Yeah.
Okay, that's interesting. So in terms of, I would say, medicine. So now you're off studying. How did you find it? Was it what you expected? Was it different? Was there a struggle at one point you decided, I've had enough of this, I'm going back home?
So I think preparation was the most important thing. We all know the current economic status, socioeconomic status in Cuba.
Mm-hmm.
It's no secret to us in the region. And having not spoken to people who have been through the system, who had gone to Cuba, finished the training, getting the experience,
Mm-hmm.
you kind of prepare yourself for it. Now,
Okay.
if it was a case where you wanted a luxurious lifestyle, or you were going to Cuba for fun as opposed to really
Mm-hmm.
focusing on what you want, which is to become a doctor,
Mm-hmm.
it probably would not be the place for you. But if
Okay.
you go in there with the determination that you want to become something in life with that
Mm-hmm.
opportunity, you just go for it. So I kind of knew what to expect. So I went there with that mentality. I went there prepared psychologically, mentally for it. But that does not mean that it did not face challenges. There were times, one of the most important, I would say, the most difficult
Mm-hmm.
thing for me at the time of being in Cuba was not being able to communicate with your family. So now I think, Wi-Fi and stuff is a bit more readily available in
Okay.
Cuba. But at the time when I was there, that was just not a thing. So you had to pay $5 for 30 minutes of internet connection.
Okay.
Um, yeah, and if my family had to call me, it was $3 a minute, a phone call. So
And
three
you had
EC
to
dollars,
arrange it as well.
you had to arrange it because it's almost like they will call you for 5 minutes, basically, just to touch base. How you doing? How's everything? You
Yes.
can't really stay long on this call.
Not like now, you're on WhatsApp for 45
Exactly.
minutes.
No, we didn't have that WhatsApp and stuff at the time. No,
Yes.
that was just not readily available. So
Uh-huh.
I think that was the thing that I struggled the most with
Mm-hmm.
because I'm quite very close to my family, and not being able to communicate with them freely or when you really want to. That
Mm-hmm.
was a bit of a struggle. Um, But I would say what really kept me going in Cuba was
Mm-hmm.
church.
Okay.
So I am a Seventh-day Adventist.
Okay.
So I'm a practicing Seventh-day Adventist. And I think being a member of the church and having church members stand with me,
Mm-hmm.
supporting me,
Mm-hmm.
sometimes they would invite me
That
over for
positive
food.
encouragement. Yeah.
Absolutely. That was what I think that was the most important thing which kept me going, even when I felt a bit down. Just having these people around you to encourage you, make you forget about your troubles, like they would say. Just remind that you have a
Yes,
new
yes.
family in Cuba, you have a church
Yes.
family in Cuba. So that I would say to me was what really pushed me, and then it just made me go all the way.
Oh, wow. So you were really fortunate to find a family away from home. The
Yeah,
ones
and
that,
actually had
yes.
a yeah, actually
Yeah.
had a family. I mean, we still stay in touch now. They're
Okay,
actually in
good.
Miami, so they moved to Miami now. But we're
Okay.
still in touch after all those years. We still video call. We still
Oh,
yeah,
great.
still touch base with them. I've met them a couple of times in the
Mm.
US.
Oh,
So
nice.
we really yeah. So I'm still very appreciative for all the support that they provided.
Okay, fantastic. And that was good. And what's key too is that you were open to welcoming them into your life at the time and
Absolutely,
recognize the support.
absolutely.
Yeah. Okay, great. So thanks for sharing that experience and those connections that you made. So now that we've learned a little bit about that journey, urology, how did you make the choice to settle on this field?
So when you go through medical school,
Hmm.
um, when you start doing your clinical years of medicine, whether you want to say fortunately or unfortunately, depending on how you look at it, you have to do a bit of everything. So you
Okay.
do general medicine, you do your surgical rotation,
Mm-hmm.
pediatrics, literally a bit of everything, family medicine.
Mm-hmm.
And I think most people, even when you thought that you want to do something, unless you actually experience it, you can't
Mm-hmm.
really say for sure. Some people, yes, they'll probably say, yeah, that's what I want to do, and they'll keep their mind to it.
Mm-hmm.
But in my case, like I said, mine fluctuated as time went by.
Mm-hmm.
But when I did my urology rotation and I realized, oh, wow, that's actually nice. You have some good clinical stuff. You get to operate. You have some cool operations. I was like, aha, that's the
That's
one
it.
for me.
I can't get gynecology. I'm not going to gynecology, so
No, not. I'm going to the other extreme now. So yeah, then I thought, and although urology was only like a 3 week rotation, only 3 weeks of urology, so the experience in urology was not like general surgery, which was about 6 weeks, and internal medicine, which was about 13 weeks, and
what?
gynecology, which was a lot longer. Urology was about 3 weeks, and even then, I thought, I think that's it. That is it. And I went home with the mentality that it's going to be urology.
Okay, all right. That means it's your calling because it didn't take long for you to be drawn to that particular
Yeah,
specialization.
absolutely, absolutely.
But on a very different note, just out of curiosity, do you know why that those timelines were assigned?
So I
Bec-
think the more popular rotations, or if I don't want to, when I say important, I don't mean importance in terms of the significance, but it's just that, for example, general surgery, you get a lot more as a doctor to manage general surgical pathologies compared to urology and ENT and ophthalmology. Whereas, if you're in an A&E, for example, most of the general surgical stuff, you probably need to know how to at least stabilize a patient, manage a patient before you can refer them onward. Unlike urology, for example, most of the urology stuff can be referred as an outpatient, for example.
Okay.
So yeah, so a lot of the stuff has to do with the importance of it being able to manage it as a general doctor. Because
Mm-hmm.
at that level, they're not hoping that you become a specialist. They want to know that as a general doctor, that you're
Mm.
able to safely manage these patients. And I think, stuff like internal medicine and
Okay, I see.
pediatrics, these definitely you'll probably have a lot more encounter, a lot more patients coming in with pathologies from these specialties compared
Mm.
to urology and ENT and ophthalmology. So I think that might be the rationale for the timeline.
Okay, all right. And just for clarification and edification, what do you mean when you say pathology?
Oh, when I say pathology, I'm referring to like the disease, a sickness.
Okay,
Yeah.
okay.
So
All
someone,
right,
yeah.
good. So we're all the wiser now. Thank you. Okay, so urology, men's health, all of these kinds of things. We're talking International Men's Day this particular conversation is being introduced on International Men's Day. When people hear urologists, they often think only of the prostate and maybe urinary issues. Explain a little bit more about it and what exactly you do as a urologist.
Yeah. So unfortunately, this is, a myth. And most persons actually think that urology is all about the prostate. We do so much more than just the prostate. Granted, I would probably say the bulk of our work might be prostate, especially in the Caribbean region. But there is a lot more to urology than just the prostate. Now, the first thing I would say is, as urologists, we don't only treat men.
So that was going to be one of my questions. So now you've answered it.
Right. So urologists, we treat ladies as well. So we treat the women as well. So urology is, what we do is we manage diseases that involves the urinary tract in both men and women. So we're looking at the kidneys, we're looking at the ureters, which are the tubes draining your kidney down into the bladder. We look at the bladder and we look at the urethra. So these form part of the urinary system. And as urologists, we manage this in both male and female patients.
Okay.
However, we also manage the male reproductive system. So that's where the men bit comes through. So we're looking at the prostate, we're looking at the penis, we're looking at the testicle, we're looking at the seminal vesicles, anything to do with the male reproductive organ. This is where we step in. So basically, in this regard, we're the opposite of a gynecologist from a reproductive organ perspective.
Today's episode of Begin, Build, Blossom Your Business Journey is a special initiative presented by CME Accounting LLC in partnership with the Saint Lucia High Commission based in the United Kingdom. Okay. All right. Wow. So you shed a lot of light there because even for me, I mean, I was thinking, okay, a urologist, this is all about men. So I'm glad that you were able to give those particular explanations so there's clarity and there's no longer any doubt in that. So from your experience, what are some of the most common health concerns, since we're focusing on men on this particular occasion, that men tend to ignore and not seek help?
So I would probably say, so the first thing I should say is, one of the advantages I have of being in the UK is being able to having the opportunity of working in areas of different demographics. So looking at different racial demographics. So I did my specialty training up in the Merseyside region. So that's Liverpool, Manchester area. And I would say the predominant population there is white, Caucasian. Compared to when I came down to London to do my fellowship, you have a much more mixture of cultures and racial backgrounds. And it will be interesting to see the contrast between the different races as to how they respond to their health. And I think, especially, and I'll mention, for example, the prostate, which is the one that everybody, urology, link urology to. So, for example, in the northwest of England, like I said, the majority of the population, I would say, or at least those persons I need to attend to were mainly the white population. And the approach to health was a lot different. So you'll see men who come and they'll get their PSA blood test done. You'll say to them, I want to examine your prostate. And most of them would be willing, no hesitation, no issues at all. They'll come up for their follow-up. You'll ask them to come for follow-up, do certain investigations, and they'll come for that. There's a higher level of compliance. And then you come down to London where, and as a black man, I can say that, where our black men, it's a whole different story. Having to explain to a black man why they need to have a PSA blood test done, why you may need to examine the prostate. Although now, the fact that we get in an MRI scan, one might argue, is there really a need for a DRE, which is a prostate examination? But it's still something that's useful. It provides useful information. And then even follow-ups and having to convince men, even after you've diagnosed them, black men, for example, that they need to have treatment for certain things. It's a whole different ball game. So I think race, to answer your question, would have a role to play as to how men respond to their health. So to further answer your question, so we're looking at cardiovascular health. So you look at diabetes, high blood pressure, high cholesterol. So these are those those, what we call non-communicable lifestyle diseases, men generally would probably not pay too much attention to that. We've spoken about the prostate, which is the PSA, one of the things that we see very, very frequently. So
yes.
I think these would be some of the most frequent things that men would probably be a bit hesitant in investigating.
Okay, all right. So thanks for sharing that, and it's good that you're able to shed light on it. So it's not just, we can't just make a blanket statement on saying all men, but from experiences based on the race and the interests in just following up on their health. When we talk about encouraging them and things to consider, what would you say are some of the things that men should look for in their health? So even if they haven't gone to the doctor, what are the things that they should pay attention to? So this is information advice time.
Yeah. So education is important because a lot of men are probably just not aware of what's happening sometimes, innocently, whereas some are aware and they ignore it. So you'll have some men who just think that, they're experiencing certain symptoms, but they think it's normal and they don't pay too much attention to it. They adapt to it. It becomes part of their life and they just learn to live with it until, unfortunately, if it's something that's nasty, until it becomes a bit too late for them. Whereas you have some men who just figure, just leave it alone. They figure something is wrong, but they just couldn't be bothered doing anything about it. So trying to convince men that I think education is the first step, so that men are aware of what is normal, what is abnormal, what they should expect at a certain age, and what should not be happening at a certain age. Because once you have that information, that's the first step, because you can now recognize that there's something going on. You could now say, oh, well, that should not be happening, and it's happening, so maybe I should look into it. The other thing is, once you've identified that there's something wrong or something is unusual, seeking help, seeking medical professional help. Now, you'll have a lot of people who go to Dr. Google, and a lot of patients, when they come to me, you can see that they've gone to Dr. Google because because some of the questions that they ask us, and that's fine. It's good that you educate yourself, but just be very careful how you interpret what you read on the internet. Because
you have to go down the line. I'm not a doctor, and I'm saying you need to go down to maybe the fourth or the fifth one to get the real information.
Absolutely, because something that could be very simple, some men will come to you panicking because Google told them that they have cancer. Or even when something that's a bit more serious, Google would probably tell them, don't worry too much about it, that's fine. So the second step is being able to seek the right help. And I would recommend professional help. So fine, you want to read, you want to go on the internet and read, broaden your knowledge, that's fine. There's nothing wrong with having knowledge, but how you use this knowledge is the most important thing. So I think men understanding that they need to seek help is important. And second, the third thing is understanding that if you do not seek help, what the implications can be. So certain problems might not cause you an issue later down the line. That's fine. It may not be an issue. For example, if you just have an enlarged prostate and nothing changes with time, it might just cause you some symptoms. And if you're able to live without it, it might not progress. It might not get any worse. That's fine. But you can have other conditions. For example, if they're not treated, you need to understand the implications, where it can cause further problems, complications, and ultimately can lead to death in the worst case scenario. So I think this is how I would approach it. Once men have this necessary education and knowledge, then they can take charge of their life.
Okay, thanks for sharing that. That certainly speaks a lot to building awareness and encouraging men to take ownership of the decisions around their health. Now, men form part of families. They form part of workplaces, their partners and support system, friends, brothers, uncles, whatever title we'd like to assign. What role do you think that these people in their lives, their partners, their families, and workplaces can play in supporting men's health awareness?
Extremely, extremely, extremely important. People who know me would tell you that I'm a big advocate for education. So I'm always making presentations. I'm always going, even schools, making presentations, going on the radio, on television stations. I do a lot of health talks and stuff, to bring awareness to certain things. And one of the things I do when I have in-person conferences or teachings or presentations, sometimes they promote it as a men's issue. And I always say to the promoters, no, because the problem is, one, first of all, the men might not attend.
Yes.
And secondly, And secondly, the important thing is having the family there with them. And that's for various reasons. One, it solidifies that you have that sort of support. Okay. Two, the man might come there, he might hear something, and he totally forgets what a month later, he's forgotten what was discussed. And then you have your support system, which can say to you, but no, that was discussed, that was said. You should probably go to a doctor because the doctor said, if this happened, if this should happen, you should see a doctor. So you have that sort of support to help encourage you. The other thing is, sometimes we are aware that men are afraid of going to doctors. Okay. I've had incidents where wives have had to threaten their husbands by withdrawing sex from them, for example, if they don't go to a doctor for certain medical problems. So men generally are afraid of going to doctors, generally speaking, I would say. Okay. So having support system from whether it's your partner, your daughter, your mother, your sister or another sibling to push you, to encourage you is extremely, extremely important.
Okay, wonderful. Thanks for that. And so, people out there, remember, everyone has a role to play in helping our men to focus on their health. Now, normalizing the conversation about physical and mental health among men, especially we probably could say our Caribbean or our Black diaspora. How do you think we can do this? Normalize that conversation.
I think it's extremely important because it's something that's almost inbred in us. So from a young age, the way you hear certain people speak, because if you mention to a younger child, let's say a teenager, about a prostate examination, to them, that would be the worst thing you could ever mention to them. About a doctor putting their finger in their behind. Oh my goodness, that's like
the world has come to an end.
The world has come to an end. So I think it's something that we have in us, a cultural thing, and I think it's a lot. It's going to be very difficult to break that sort of transition, that sort of transmission, if I should say. Normalizing communication, I think it's all about education. I say to patients all the time, and that's one thing I use when I see a lot of the Black men in my clinic. I use myself as an example. And I say to them, look at me. I'm a Black man just like you, which means I have a prostate, which means I have a high risk of prostate cancer as well, just like you. And guess what? I will be taking care of myself. I'll do my PSA when I need to. I will get my prostate examined if I have to. If someone recommends something to me, I will do it. And that's because I think it's the right thing for them to do. And that's why I'm encouraging you right now to do it, because I think it's what's best for you. So that's one of the strategies I use, using myself as an example to motivate men to take charge of their health. I don't know that there is going to be an easy way to kind of break that sort of
to normalize it, to make it
I think it's
not just an ordinary conversation.
No, I think it's education, and hopefully we can reach people individually, and then eventually we have people who would be a bit more receptive and open to these kind of things.
Okay, so the common thread from what you've been sharing is sharing of information and making persons aware of what's available out there. So this is quite insightful for that. Mental health. It's another issue that we don't normalize, and particularly for men, because they're taught to keep everything inside. They're taught to keep everything inside. Men shouldn't cry. You always need to be strong. Don't show any emotions. What would you say is a good approach for men dealing with mental health challenges?
So I think trying to destigmatize mental health would be the first start. Because, for example, in the Caribbean, or at least in Saint Lucia,
Mm-hmm.
If someone says to you that you have a mental health issue, which could be anything, it can be from a simple depression, or you just, something simple to something more complex, and everybody automatically thinks that's the end of it for you. Oh my gosh, he's nuts. He's losing it. Oh my gosh, it's like that's the end of the world. And I think it's all about stigma. Because people can be depressed, people can be grieving, people can be going through different situations in life, and they just need that sort of, someone to speak to, someone to talk to. But because of the stigma associated with it, they might stay away. So I think men should understand that there are people available who are willing to help. There are people who are available who want to offer the help, and they should seek help when needed. We have, and you look at from a child, if you have a boy child, for example, you'll hear people saying, oh, boy shouldn't be crying. If a child has an issue and the little boy starts crying, but you're a boy, what you crying for? And because we make it look like, a little girl should be crying, but if a little boy has an issue, he should just stuff it up, keep it on the inside, and not cry about it. And that is wrong, because we are already building that wrong perception in them.
And it's in their psyche that it's there.
And they grow up with it, that as a man, I should just keep my issues to myself. I should not have to say anything. I don't have to say anything to anybody. And unfortunately, this is why we might have a much higher suicidal rate in men, because we don't talk. We don't air out our issues. We don't air out our problems. But men should be made aware, or men should know that help is available. You can speak to somebody, find someone you can confide in. It doesn't even have to be a professional. I'm not saying that you have to go to a psychiatrist or a counselor. No, even a family member, even a friend, even a co-worker or colleague,
someone trusted,
you can confide in, just to speak to them. And sometimes you'll realize that, hey, I'm not the only one going through this problem. There's someone else who's going through the same problem. You understand how they dealt with it. You understand what sort of measures that they use. And sometimes you can adapt that into, your own life, and that could make things better for you. So this, I think, is the approach that we can take. But I think unless we tackle it from the root of the issue, which is where we make men believe that, just like if you have a man and a woman and they break up their relationship, the man should not cry But why not? If he loves his ex-partner, he wants to be with her. There's nothing wrong with crying. No. It's just
don't stay crying.
Because to some people, if you cry, they call you all sorts of names, and because as far as you're concerned, it's not normal. When in fact that's not the truth.
Yes, it's very normal. And so with you explaining all of that and sharing that information, about mental health and depression and the different, I guess we could say, aspects of it, how can someone identify that they're experiencing a mental health issue or challenge? What would you say are some of those signals?
Yeah, so sometimes the person themselves may not even recognize that there's an issue.
Yes.
And it could probably be a family member or someone else, a teacher, someone else who will be able to recognize it. Because, as far as the person is concerned, they're just living their life as normal. But then you'd realize they're probably not eating, their hygiene is not as it used to be. You realize that they're putting on weight, or they're just not interested in anything. Or, for example, in the case of someone who's psychotic, going through they hear voices. And as far as they're concerned, it's real. They're seeing things, they're hallucinating.
It's normal. Yes.
And as far as they're concerned, it's there. So they're not within that reality of knowing it's not there. And this is where support comes in, because if you realize that something is wrong, try to speak to them. The problem with that is it gets very difficult, you trying to convince that man that something is wrong with him, when he is saying, well, I'm seeing the stuff, but you're telling me how can you tell me it's not there when I'm seeing so sometimes it's speaking to them. Don't make it confrontational, because that could make things worse.
Or empathize, I suppose.
There, exactly. So then you realize, okay, we're not getting anywhere and there's a problem. You could take the next step, which is to see if you could seek professional help for that person, whether they're willing to speak to someone, get professional help. But I think most times it tends to be that someone else would recognize that, hey, something is amiss there. Something is not really right there. And as opposed to the person actually realizing that something is wrong.
Mhm.
You do have men in certain situations, or not just men, people in general in certain situations who would self-present and be like, you know what? I think, I feel a bit depressed. And sometimes we use that word loosely, by the way. Let me just say, when we say depressed, because sometimes you just suddenly like, oh, I'm so depressed.
Yes.
You know?
Yes. And we don't really appreciate what it truly means to be depressed.
Exactly. So, but some people will themselves recognize, oh, yeah, I think I need to just speak to somebody because it's just too much to keep in on my own. It's just too much to bear. And maybe if I just speak to somebody, especially a professional, that will make things a bit better for me. So noticing changes in your daily life is important. The things that you used to enjoy doing, you no longer enjoy doing it because you just lost interest. You're just a whole different person, the way you interact with people. These can all be alarm bells as to whether there's something going on. Now, it does not mean if you used to love cricket before and all of a sudden now you decide you don't want to
like
do
cricket, you want to do football.
That's not mean you have a mental health problem. But I'm just saying, if you have a certain situation going on and then you realize that you're having these subtle changes coming along, maybe it's time to consider, could there be something there? Your family could appreciate it themselves. And then, together try to help him so that he can seek the necessary help needed.
Okay. Oh, wow. I am really enjoying this conversation, and I trust that our viewers and listeners will gather so much insight and information and guidance from what you share. As you're giving that information, more questions are just popping into mind because specifically as it relates to depression and identifying what that is, because as you rightly stated, we always so easily say, oh, I'm depressed. Something happened we don't feel comfortable with, things didn't go the way we wanted it to, we're depressed. But what are 3 signs that you could tell you're depressed? Is it just the moodiness? I don't feel like talking to this person today, or I don't feel like doing things. What are some of the common signs of depression?
Yeah, I mean, obviously, I'm not a psychiatrist. I'm not going to
Yes,
pretend
but
to be
just general
a
things that
psychiatrist.
people
But
might
yeah,
present, yes.
but generally, what you will find is someone who is in a prolonged state of sadness. So,
Okay.
for example, someone who is grieving, you allow a normal period to grieve. But sometimes as it gets beyond a certain stage and you realize how it's affecting your life. So, for example, you're in a prolonged period of sadness and then you don't want to eat anything, no appetite whatsoever, you don't want to eat. Like I said, your hygiene changes, you lost interest in anything that's the things that you used to.
So those are
all of a sudden you're not interested in these things anymore. You don't want to interact with anybody. You now isolate yourself socially. So these are some of the things I would say that would raise alarm bells. It does not necessarily mean that you depressed, but I think if I have someone, a friend, a family member who's going through a difficult time, who's had a difficult situation, and I notice that, a few months later down the line, you can kind of pick up that something is not really right there.
And to call in the professional.
Yeah.
Okay. All right, great. Thanks for sharing that. So as we move on to lifestyle, habits, annual checks. So earlier we acknowledged that, people don't do these things when they need to. But in terms of giving advice, what would you recommend as a basic routine for men in critical age groups?
Right. So I think age group is important, but not just age group. We have to look at risk factors as well.
Okay.
So that's one of the important things that would determine what sort of lifestyle modification or what sort of help that you need to seek. So for example, if you have a strong family history of prostate cancer, and I'll always start with prostate cancer because as Black men, it's one of the headaches that we have to deal with urologists. Your risk for prostate cancer obviously is high, and then we would recommend early detection, which is what we call surveillance. Now, if you have a family member who has history of diabetes, high blood pressure, obviously it's something that you want to keep checking as the general population, yes, but I'm saying that your risk is probably a bit higher and you probably need to pay a bit more attention. If you look at, for example, if you have other medical heart problems, eye problems, so for example, glaucoma is recommended after the age of 40 that you at least have checks if you have a first family history of glaucoma. So the answer basically is age, as well as risk factors, looking at family history as well. And that would determine what sort of checks that you do, at what stage, how soon, or when if you don't have to do any at all.
Okay. All right, great. Thanks for sharing that. So that definitely brings a section where we talk about awareness and, just men's health and those common signs that we can look for or symptoms in identifying issues potentially in the future. So in terms of your work and lessons learned as you grow, develop, what would you say is a major lesson you've learned during your studies, practicing, and just being a man in the community? So many of
Um,
them, huh?
I know. One is being understanding and patient.
Hmm.
Sometimes, unless we speak to people, we don't really understand why they do or don't do certain things.
Hmm.
Because sometimes we're really quick to judge people.
Hmm.
Sometimes we're really quick to cast people aside without
Hmm.
really understanding why
Hmm.
they've done certain things or not done certain things.
Hmm.
Something as simple as, for example, certain men will come to us and you give them a prescription and you'll be like, okay, this is your medication, take that. You give them a repeat prescription and then you say, see me in 3 months' time just to assess to see how things going. And then they
Hmm.
come back to clinic and they say, oh, I took the medication and when it was done, I didn't take any more. And then, maybe initially you'd be like, but what are we really doing? But then you might understand to them because one, they were not aware or they didn't understand that they actually had to continue taking the medication. They probably
Hmm.
thought, you gave me 1 month supply, it was done. So that's it.
Yes,
That's it. I
yes.
don't need any
They
more.
didn't pay
Or
attention. Yes.
yeah, or some of them would be saying to you, for example, well, my blood pressure was high. You gave me this medication, and my blood pressure now has dropped. So I'm cured. I
Uh-huh.
don't need any more medication.
Yes,
So
yes.
unless you really speak to them and explain the importance of doing certain things, sometimes it could be difficult. So I think for me, patience and understanding is important, and not be quick to judge people,
Hmm.
but to work with people because you'll be surprised sometimes. Some of the things that you think
That's
you
common
know,
knowledge.
that's common knowledge. Sometimes you realize, oh no, actually it's not. And then so you just have to take it down to the level of everybody.
Okay, okay. All right, good. So that definitely guides the practice and your interaction with patients.
Absolutely, absolutely.
Okay. All right. So next, I mean, we will always need doctors, or we will always need medical practitioners. What advice would you give to young people, especially those in our beautiful country of Saint Lucia, or who aspires to a career in medicine?
Go for it.
Hmm.
But it's a huge sacrifice. It takes a lot of time, a lot of effort,
Hmm.
but the reward is important. And when I say reward, I'm not referring to financial reward. And with that said, the primary reason for going into that field should not be money. Yes, you make money out of it. We're not going to deny the fact. It's one of the well-paid professions, so no one is going to sit there and pretend that, doctors, you live comfortable as a doctor. No one is
Hmm.
going to deny that.
Hmm.
But it should not be your primary reason for doing it because you then find yourself doing a lot of stuff that you should not be doing. And when I say that, I'm referring to whether you lost your sort of humanity, that sort of humanity you're supposed to have in you to help people. It just
Hmm.
becomes driven by money now as opposed to the
Yes.
passion for helping people.
Yes,
So
yes.
when you get yourself having to stay extra. So for example, in my fellowship, I'm supposed to work from 8 to 5. These are my working hours. And I probably can count on one hand the number of times I actually left the hospital
At
at
5 o'clock.
at 5 o'clock. Sometimes 8 o'clock, I'm still there. On a weekend, I'm on my laptop,
Uh,
working, getting stuff done. And you don't get paid for it, but you're just thinking, you know what, it just needs to
for
be
that
done.
good, yes, and
So you
to
have to
to make
do
it
it.
complete.
Yeah, you finish your shift, for example, you've been on call overnight, you finish your shift and you're thinking, I just want to go to my bed. But no, there's this one patient who still needs sorting out, who needs your assistance, you'll do it. And it's just because of the goodness that you have in you and willing to help people. So the first thing is go for it. It comes with a lot of sacrifices, determination. You'll have to put out a lot in it. And just remember the reason for doing it is to help people, especially your family members, your friends, your countrymen, your colleague. You never know when they would need you. So go for it and give it your best shot.
Okay, what wonderful advice that anybody could apply. And to take from what you just said in terms of helping people, There was one area that we did not cover in our earlier discussions, and that is your subspecialty andrology.
Yes.
Tell
So
us, what was the inspiration behind this, and tell us what it is.
Okay, so andrology is the branch of urology which deals with the male reproductive organs.
Mm-hmm.
So we're looking at, for example, erectile dysfunction, we look at ejaculatory issues, we're looking at abnormalities of the penis that need surgical correction, we're looking at narrowing of the urethra, which is the pipe which runs through the penis where you pee. Sometimes if this you've strictured, we deal with that. We deal with infertility, any problem to do with the testicle as well. So, that sort of reproductive bit of urology is generally dealt with by andrology. And that also includes cancer to that area as well. Okay. But my subspecialty is in the benign aspect of andrology. So I don't do cancer bit of andrology. So I would do stuff like fertility treatment. So I harvest sperm from testes in men who are not able to have children. I manage urethral stricture. I treat erectile dysfunction by doing surgery, putting implants and stuff like that. Do curvature correction of the penis. And it's just something that there were two reasons why I wanted to do it. One, it's something I enjoyed doing. So as part of my training, when I was exposed to that area, it was,
Yes, I saw the demonstration, listeners. Yeah, I could just say the demonstration. That's what.
But when you see men who come to clinic and they would say to you, for example, they've tried everything, they've tried all medications you've given to them, their relationship is at a point of of breaking up, their partner is about to leave them because they can't have an erection, or and then you can then offer help and see them come back to clinic with the brightest smile on their face because they feel like a new man. I thought, to me, that was something very satisfying.
And rewarding.
I thought that was something that I want to pursue. Okay. The other reason is, in the Caribbean, this is not a service that we have that's well established. Especially, I can talk for Saint Lucia for sure, and the rest of the Eastern Caribbean. So I think, having had this training now, and as I'm returning to Saint Lucia, the aim is now to develop such a service, not just to treat men locally, but at least to be a referral center or reference center for the rest of the Caribbean, the Eastern Caribbean, or the Caribbean at large, for men who need this sort of specialized help, to be able to offer help for men, because, men feel that that's the end of the world if you can't get, the help that they need, and they feel desperate. And unfortunately, we've had men who've committed suicide because of, not given to get the help that they need. And I think, I want to be able to offer that service, especially to our men who need it. Okay.
All right, great. I'm edified. I had never heard about andrology before, but certainly I would have heard about, fertility issues and erectile dysfunction. So it's good to be able to learn what the heading is, that overall, the specialty under which andrology falls. So thanks for sharing that, and very best wishes with that. I believe because it is not existent in the Caribbean at the moment, you have an opportunity to benefit from that and becoming the regional hub for such a service.
I would love for this to happen. I think it will be challenging initially, because
of course,
these are some of the
because
things
it's
that
new.
Men don't, and not just that, men don't want, even if they experience certain problems, they're embarrassed to come forward. So for example, to them, it's so embarrassing to say that I'm having erectile dysfunction.
Yes.
To come forward sometimes is the biggest step. But at least I want men to understand that, you should come forward, because there is help available. The only way you can get the help that you need is if you seek the help.
That is correct. Ask for help and you shall receive it. Right? The Bible says, ask and you shall receive.
Seek and you shall find. Absolutely.
Yes, seek and you shall find. Okay. Now, personally, balancing the professional demands. As you mentioned, it's about sacrifice, it's about commitment. This is not to say you're abandoning your family or you're abandoning your friends, but definitely there's always an opportunity cost. How have you been able to manage the profession and family?
Yeah, it can be quite difficult, and I'll probably be the first to say that maybe I have not found that perfect balance, because you still find yourself sometimes, kind of, because of the kind of the professionality, the kind of work that you do, you tend to find yourself sometimes prioritizing work. And I'm saying that, because sometimes the decision that you make, for example, on a Sunday, if I'm supposed to be doing something else and there's an emergency at work, because of it's within my subspecialty, sometimes I have to go in. I remember the last Sunday I went in, I literally spent 15 hours in the hospital, and that's not being on call. But just because there was a man with a problem that was within my subspecialty, and I thought that, because the person who was on call, that's not their subspecialty. And to be able to give the patient the best possible outcome, it's always better for an expert. If there's an expert available, for the expert to treat the patient as opposed to someone who's not really, experienced in managing that problem. So sometimes, you'll always find yourself having difficulty getting that right balance. But the important thing is, as much as possible, to be able to. And I think that's where support comes in, being with someone who understands your profession.
Yes, I'm not saying partner who appreciates.
Absolutely. I'm not saying that, you should always put work before your family, and every time there's an opportunity, you have to run, especially if there's someone else who can help, you have to run, because that's good. Because, like I said, getting that right balance, but, sometimes it can be quite tricky to get that balance, but as much as you're able to. Now, for me, fortunately, my family has not been within the UK throughout this entire journey, so it's been a lot easier. But obviously, now that I'm home, it now becomes a whole different situation. But as a consultant, it makes it a lot easier to balance as opposed to
a consultant surgeon, shall we say? We did not mention that earlier. Dr. Jimie is also a surgeon. He's not just a practitioner. Okay, so we can check him out for all our needs. So tell us, yes, as a consultant, there is more flexibility.
Yeah, you do have more flexibility because the amount of time that you actually spend in the hospital is not going to be as much as when you were a junior doctor or a resident doctor, where you're practically there all the time. Most times you would tend to go in when needed and when it's out of hours and stuff like that. So you get a bit more flexibility to be with family. But the point I want to drive across is sometimes it can be difficult. We should be able to get that right balance as much as possible, but sometimes it can be tipped over for one. But having that sort of support, the right partner to understand, would probably make things a lot easier.
Okay. Yes, and that is very true. I was having a conversation with someone else in a previous interview, and that's one of the things she said is there isn't a balance. Especially we were talking about women and so on and being a mother, because when you dedicate time to taking care of your child, it means that maybe work is not going to get that attention, a project is not going to get that attention. And so the same for you when you're at work doing your job as a urologist or a surgeon, then that time you can't have with family. But when you're with family, you're not able to give any assistance in the field. So really and truly, it's about that support system. It's about having that network of people who can also do the same, because you rightly said, you don't always have to go. There may be someone else that you can call on to fill in at the time. So utilizing the network, utilizing the experts that are around.
Absolutely.
Okay, wonderful. So as we're bringing our conversation to a close, it's a special episode for International Men's Day. What does that mean to you, though? I mean, we have International Men's Day, we're celebrating it, we're acknowledging it, but what does that mean to you as a man?
I have asked myself this question on multiple occasions. Every time International Men's Day come around. With that said, every day should be International Men's Day. But, I understand that there's a day that has been set aside to celebrate our men. And I think that's important, so that men understand that they are valued, men understand that they're appreciated, and men understand that they're not alone. I think, we should not only highlight men who've been successful in the field and men who've done great things. I don't think that's what it should be about. I think it should be having a balance to also say to men, you know what, we understand your struggles. We understand your deep the problems that your internal struggles, the difficulties that you go through. But just also know that we honor you, we celebrate you, because we're there to support you as well in whether it's an emotional, physical, or mental issue that you have. we're there with you to support you. So I think, to me, that's the most important aspect of International Men's Day, as opposed to, us celebrating great men who've achieved great things. And because a lot of people place so much emphasis on that, because that's that's what we do. I mean, with human nature, we obviously give more praise to people who've done great things and who've been successful in life. But sometimes the other man who've made that little contribution, or what seemed to be a small contribution, could just be the greatest contribution. And sometimes we neglect them. So I think that day we should try to incorporate everyone and focus on everyone. And the important thing for me is making men understand that there is a support network available. We're not on our own, that we have support for us around.
Okay, I appreciate you sharing that insight and your perspective on International Men's Day, and it covers quite a number of key points on its own. What's next for Dr. Jimie? Or should I say Mr. Joachim Jimie? And I think perhaps we'll have to explain to our audience what's the difference between the DR and the MR.
Right. So in the UK, it's a different system. So in the UK, once you've done what we call your Royal College of Surgeons exam, you're certified on your first exam, you change from a doctor to a Mr. You're still a doctor, but the heading is different. You become a Mr. And then that just follows you for the rest of your professional career. So most surgeons would be a Mr. And then you have the medical doctors being doctors. Once obviously back in the region, I go back to be doctor. Because I'm pretty sure if you go and they say, I'm Mr. Jimie, like, can I see the doctor, please?
Yes, that's true, because we don't have that understanding
that culture
of, the culture of what the title really means. That really says you're a surgeon. Okay, great. So what's next for you, though?
So for me now is build on what the experience, the knowledge that I acquired in the UK, now to develop that in Saint Lucia and implement it, to treat our men, give men the opportunity to get the help, the care that they need, care that was not previously available, to make it available to them, to reach out to our men, make them understand that, it's a safe space. If you need help, you come see the doctor. You could get referred if you need to, but the important thing for me now is to develop an andrology service, like I said, in Saint Lucia, so that, men don't have to travel abroad to get certain treatment needed, but we can hopefully provide it locally, and not just to our men in Saint Lucia, but looking at the men in the region, especially in countries where they don't get such services. And I'm talking about services like being able to do penile implants, being able to do fertility treatment, complex urethral stricture disease management, basically being able to provide that sort of surgical skills, which is currently not readily available in the Caribbean.
Okay. All right. Excellent. So sounds like you have an incredible, we might say, mountain to climb, but you know what? I have faith that you will do it. You will build a network, you will find the support, and you'll get it done. So I look forward to seeing Mr. Joachim Jimie, andrologist specialist in the Eastern Caribbean.
I appreciate that greatly.
Okay, wonderful. So if our listeners wanted to reach out to you, our listeners or viewers wanted to reach out to you, how can they get in touch?
So for me, I would say X is probably one of the most frequent things that I use from a interaction perspective when it comes to medical stuff. And my X handle is at JimieDean1. So JimieDean 1. So this is where, I network with a lot of colleagues and professionals like myself. Facebook, I use Facebook, but not very much for interaction. So I use Facebook more like promotional stuff. So I watch a lot of news and sports and other stuff on Facebook, a lot of political stuff on Facebook. But not to actually, so if people would say to me, I messaged you on Messenger. Nah, you're not really going to get your I would have responded, so I don't really. But I do respond to my messages on X and on Facebook. If I'm tagged in anything, then, we can interact. But if you message me, I probably would really not get a response on Messenger.
Okay. All right. Wonderful. So, Dr. Jimmy, thank you for sharing your journey, your incredible experience so far. And I have no doubt that you will continue to make a valuable and invaluable contribution to not just St. Lucia, the Caribbean, and the world as you continue to empower men to take charge of their health. To our listeners and viewers, remember, strong men ask questions, seek help, and take care of themselves. This special episode of Begin, Build, Blossom, Your Business Journey was produced in collaboration with the Saint Lucia High Commission in the United Kingdom for International Men's Day 2025. I'm Angela Sendenis, your host for today. Until next time, keep beginning, building, and blossoming. Thank you, and bye for now. A quick note before we wrap up. The insights and experiences shared by our guests are their own. We love creating space for real conversations about business and growth, and everyone's journey is unique. Therefore, this podcast is for informational and inspirational purposes only. It is not meant to replace legal, financial, or other professional advice. So, we encourage you to take what's useful, do your own due diligence, and build what works best for you.
Thanks for listening to Begin, Build, Blossom Your Business Journey. We hope today's conversation gave you the insights and inspiration you need to move forward on your own path. Don't forget to subscribe or follow wherever you get your podcast so you never miss an episode. Do you have feedback? We'd love to hear from you at podcast@cmeaccountingllc.com. Join us again next week for a new episode.